What is Choosing Wisely Canada? And why has the Canadian Anesthesiologists Society become involved? The Choosing Wisely Canada campaign was developed to help physicians and patients for two key reasons: to engage in conversations about unnecessary tests, treatments, and procedures, and to make smart and effective choices to support the delivery of high-quality care.
The objective of Choosing Wisely Canada is really to engage physicians and patients in conversations about the overuse of unnecessary tests, treatments, and procedures. This is in order to help patients make informed choices and to get the right care they need, but to avoid tests that might not be necessary or might even be harmful.
Choosing Wisely Canada has gained national traction, and the message is being heard. It's the right approach to delivering patient-centered care and ensuring our precious healthcare resources are used wisely.
The Canadian Anesthesiologists Society supports these goals and has developed a list of 5 recommendations relating to tests and procedures anesthesiologists and patients should question.
I'm pleased with the Choosing Wisely Canada campaign, which has highlighted the strategic importance of engaging anesthesiologists and, in fact, all medical professionals in selecting the tests and procedures each patient needs.
The Canadian Anesthesiologists Society component of the Choosing Wisely Canada campaign was first spearheaded by Dr. Patricia Houston, the CAS president at the time. Dr. Houston convened a small team of expert Canadian anesthesiologists, Dr. Greg Bryson, Dr. Susan O'Leary, and Dr. Daminda Wijisundara, to develop a research methodology. A Canadian survey was designed based on similar work done by the American Society of Anesthesiologists. The final CAS list is a combination of both evidence-based and member-supported recommendations.
Don't order baseline laboratory studies for asymptomatic patients undergoing low-risk non-cardiac surgery. Preoperative testing may add value in the setting of a symptomatic patient or higher-risk surgery, but should not be performed routinely before low-risk surgery on asymptomatic patients.
Don't order a baseline electrocardiogram for asymptomatic patients undergoing low-risk non-cardiac surgery. Electrocardiograms, or ECGs, performed before elective non-cardiac surgeries are frequently abnormal, especially in older patients, and do little to improve risk prediction beyond simply asking patients about their health. Serious cardiac events like heart attack are rare following low-risk surgeries, and there's little that physicians can do to further lower this risk based on preoperative ECG results. Don't order a baseline chest X-ray in asymptomatic patients except as part of surgical or oncological evaluation. Chest X-rays remain an important part of surgeons' evaluation before cancer or thoracic surgeries. However, chest X-rays are not indicated in the routine pre-anesthetic assessment. They yield few diagnoses and many false positives, leading to unnecessary further testing and do not improve risk prediction or stratification. Don't perform resting echocardiography as part of preoperative assessment for asymptomatic patients undergoing low to intermediate risk non-cardiac surgery. Resting echocardiography has a clear role for resolving diagnostic questions in surgical patients, such as identifying the basis for suspicious systolic murmurs or new dyspnea on exertion.
Don't perform cardiac stress testing for asymptomatic patients undergoing low to intermediate risk non-cardiac surgery. Stress testing can help resolve diagnostic uncertainty in surgical patients, such as determining whether individuals with chest discomfort and vascular risk factors have undiagnosed coronary artery disease. It can also help identify patients at elevated risk for cardiac complications after major vascular surgery. The CAS Top 5 Choosing Wisely Canada recommendations are a perfect starting point for important dialogue among anesthesiologists and other healthcare practitioners. particularly with regard to preoperative testing. Both patient-centered and economic considerations enter into the discussions. We must each work with our own departments and hospitals to introduce the Choosing Wisely Canada recommendations. The CAS is liaising with Choosing Wisely Canada to help you implement our recommendations. Watch the CAS website for patient brochures and posters and the PowerPoint presentation. There is opportunity for expert consultation at the CAS annual meeting and more. I strongly urge you to get involved.
For information and resources about Choosing Wisely Canada, visit the Canadian Anesthesiologists Society's website, www.cas.ca.